السلام عليكم.
وعليكم السلام.
وعليكم
وعليكم
السلام.
السلام سلام.
وعليكم السلام ورحمة الله.
وعليكم السلام دكتور هاني.
Okay, guys, today inshallah we'll practice psychiatry and toxicology. We finished all history taking, Socrates and Odipara who approach adult pediatric. So if you understand the general approach of psychiatry toxicology, you will pass all stations of psychiatry or toxicology. The same approach also of usual history taking, but with some modification. So for new members, you have 3 stations for complex stable patient. It could be history or psychiatry or toxicology. Answer questions, 2 stations for counseling. Resus, 2 stations. Injured patient, 2 stations. Examination. Pediatric emergency medicine history, 1 station. Procedural skills, 2 stations. Complex challenging situations, it means communication skills like breaking bad news or difficult referral, conflict resolution, complaint resolution. Supervise and teaching. So 2 stations like teaching nerve block or ECG or ABG, anything like that. Even teaching also X-ray. The most important domain, clinical reasoning decision-making skills. So the management plan in all stations. Communication skills, this is the second important domain. It means your attitude inside the station, inside the room. Like what? Good eye contact, empathy, sympathy, comfortability, check pain. Also give questions in basis, information in basis with pausing. Share decision with the actor. If the actor is patient or if the actor is nurse or if the actor is junior doctor, you should share the decision. Organization prioritization skills, you should organize your approach in all stations. We finished history taking stations. Today, inshallah, we will finish all psychiatric toxicology stations. Next decision, our schedule as usual will be Saturday, Monday, and Wednesday till the exam. So next time we will do ALS, and the next decision will be ATLS. The next decision will be pediatric ALS and the newborn resuscitation. So resuscitation will take 3 sessions. Practical skills and teaching stations will be 2 sessions. System, 1 session. Joint, 1 session. Communication skills, 2 sessions. We almost finished 40 batches for online and face-to-face courses. And again, online courses, more than enough to get very high score. Now we are doing batches for June and July for teaching. Once we finish the teaching, once we finish the communication skills, we will go for mock exams for June only. So practice for teaching will be for June and July. And mock exams will be for June. After the exam of June, we will do mock exams for July. For people, for doctors who joined for September or December, you will be listener. If you feel you are very confident and you want to practice, no worries, raise your hand. For people who joined for 2025, so you can attend as listener. Accuracy, it means the general approach. You should mention all the points in the station. Skillfulness, you should be fluent, and the fluent here doesn't mean you should be fast. No, even you are slow, you can be fluent, but don't be slow in resuscitation. Don't be fast in breaking bad news. So you should keep and fine tune your approach. Supportiveness, it means your communication skills, so your attitude inside the room. Efficient structure, you should be organized, and safety, you should cover the safety points. We have 5 stations for psychiatry and 2 stations for toxicology. For psychiatry, depression, mania, cognition, psychosis, self-harm. So you should cover these points in present history. It's called mental state exam. Mental state exam. Okay. Clear until here, guys?
Yes.
Yes, sir.
Toxicology, you will cover the same points, but you will add point of toxicology. So you have here psychiatry history. It's like present history. Okay. In usual history taking, we have introduction, 3 open questions, present history, past medical history, and blah, 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 blah. So psychiatry, you will modify present history to be psychiatric history. So you will ask questions of depression, mania, then questions of cognition, then questions of psychosis, then question of self-harm. Okay. Here regarding depression, mania, if the station depression, mania, you will ask all these questions. If the station not about depression or mania, so more than enough if you will ask how is your mood. Don't ask other questions. Okay. If the station is depression or mania, you will start by these questions. If the station is psychosis, start by psychosis questions. If the station is impaired cognition, like patient is very old and he is confused, start by cognition questions. If the station is about self-harm, start by questions of self-harm. Clear, guys?
Yes, sir.
Yes, sir.
Okay. In toxicology, it will be the same. Of course, the station, not depression. The station is toxicology. So start by toxicology questions. What is the name of the drug? Is it oral or injection? How often? Like daily, weekly, monthly? Why you are taking these drugs? Where did you get these drugs? Then depression, mania, one question, because the station is so not about depression or not about money. How is your mood? Then cognition questions, then psychosis, then self-harm. So you have only 2 questions in psychosis, 2 questions in self-harm, and 3 questions in cognition. The general approach, same as usual history taking. So, good morning, I'm Dr. blah blah blah. Either register me, I know your name and age, please. Maybe the patient will be silent, maybe he will answer. So, nice to meet you. How can I help you? What if he is silent? No problem. Tell him sorry to hear that. If he is silent, are you comfortable? Do you have any pain? Even still silent, no problem. I need to take some data from you regarding your mental health. So in any station, you should mention a special concept. So if the station is psychiatry, special concept. If the station is toxicology, special concept. If the station is sexual history, special concept also. So I need to take some data from you regarding your mental health. If sexual history, You will say, I need to take some data from you regarding your sexual health. We are in private room and anything you will tell me will be confidential. You can stop me at any time. If it's still silent, no problem. Okay. So when did you start to feel that? Is it affecting activities of your daily living? Is it on and off or continuous? Why do you feel that? Okay. So don't forget these questions. Then you will go for mental static exam. So this is the only a change in history. You will ask questions of depression, mania, cognition, psychosis, self-harm. Okay. Then the general approach, as usual, in a past medical disease, in a mental health problem, in a previous surgery, in a prescribed medications. So ask questions in basis and pause between questions. Any prescribed medications, any allergy, any disease running in your family, then social history. Then you will jump to the third open question. Would you like to add anything? Then the concern. Judgment and insight you can ask in the end, or you can ask number 5 and 6 here in mental static exam. So, what will you do if you smell smoke in home? The answer should be, I will call for help. So, if the patient said, I will call for help, it means the patient has judgment, intact judgment. If he said any answer apart from I will call for help, so he has impaired judgment. For example, he said I will kill myself, so he has impaired judgment. Even he knows the answer, but he did not say I will call for help. Do you feel you have medical problem and you need medical help? The answer should be yes, I know. If he said any other answer, so he has impaired insight. He doesn't know what is the problem. Okay. Clear until here, guys?
Yes, sir.
Yes.
Yes, sir.
Okay.
Very clear.
If they said present your finding, it means talk to the examiner. Okay. If they said um, assess mental state exam, okay. Okay. If they said assess mental state exam, you will present your finding. Otherwise, you will present your finding to the actor. Again, if they said assess mental state exam, you will talk to who? Examiner or the actor?
Examiner.
Examiner.
Anything else, you will talk to the actor.
Issue.
Okay. So, how to present your findings? I have patient, blah, 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 blah. Presented with, mention the diagnosis first before presentation. Whatever depression, psychosis, mania, impaired cognition, self-harm, anything like that. So his appearance, well dressed, fixes this in all stations. Why? Because he's actor. Of course, he is well dressed. Even in real practice, he will uh, be in depression. He will be neglected. But he's actor. He has good clothes. Don't say anything bad. So you can say his appearance well dressed. Okay. Behavior, mention according to the station. Don't say depression will be sitting or calm. Maybe in the exam he's not sitting, maybe irritable. So check the same attitude inside the room. His appearance, sitting. If the patient is sitting, mention sitting. If he's standing, mention standing. If he's calm, mention calm. If he's irritable, mention irritable. Okay. Maybe depression with good eye contact, maybe. Okay, so if he has poor eye contact, if he's looking down, mention poor eye contact. If he's looking at your eyes, mention he has good eye contact. Speech. If his voice is not audible, you can say low pressure of speech. If his voice is slow, the speed is slow, so you can say with a slow tone. If he said, I feel bad, you can say low mood. If he said, I'm happy, high mood. If he said, I'm okay, he did not say bad, or you can say normal mood. Thought disorder. If he has thought disorder, if you ask him and he said, yes, I have, so you can say he has thought disorder. Otherwise, you can say no thought disorder. Hallucination. It depends on the station. Don't think all psychosis they have hallucination. Okay. So maybe thought disorder only. Maybe hallucination only. Okay. So no hallucination or the patient has hallucination. If has hallucination, what? Is it auditory? The patient hear voices? Or is it visual? The patient see things. So cognition, if the patient answer your questions of cognition, so he has intact cognition. If he has impaired cognition, mention that. Judgment insight, intact or impaired. Then mention the manner. So again, you will mention the name of the patient if you remember. If you don't remember, no problem. The age, if you remember. If you don't remember, you can say gentleman, more than one. Presented with diagnosis and present the findings. Then the management plan. Fix this management plan. Patient needs a psychiatric assessment under mental health team. All patients? No. If the patient has depression, mention that. If the patient has mania, impaired cognition, psychosis, self-harm, mention the patient needs psychiatric assessment under mental health team. If the patient doesn't have any symptoms for any psychiatric problem, no need to mention he needs a psychiatric assessment. Okay? So any score? Yes, any score. If the patient has very low score, he needs a psychiatric assessment. Okay? So he is safe to be discharged? Yes, he is safe to be discharged. But don't discharge the patient. If he has very low score, don't discharge the patient. So you should advise him for psychiatric assessment under mental health team. But if he refused and you assessed his capacity, he can go because he is safe to be discharged. Any patient, if he has self-harm to himself or to the public, if he said, yes, I will kill myself, or he said, yes, I will kill people. So this one you can admit whatever under his wish or against his wish. Okay. Even he has low score? Yes, even he has low score. Patient needs counseling regarding drug and or alcohol abuse. So you will fix this management only if the patient is using alcohol, only if the patient is using a drug. We need to rule out organic cause by examination, blood test, and urine analysis. Okay, so regarding modified sad person score, already covered in general approach.
Sorry, Dr. Hani, your voice is not clear.
Okay. Is it clear now?
Yes, I can hear you.
Okay.
Yes.
Okay. So what is the diagnosis now?
Depression.
Depression. Depression.
Is it depression or likely depression?
Likely depression.
Likely depression.
Okay, we cannot say depression until you ask the patient, how is your? If he said, I feel bad, is it depression? No.
Yes. No, no, no.
No, likely
Should
depression.
be 1 and 2 weeks.
You should ask him about the duration and is it continuous or on and off. Why? Because if the patient has depression less than 2 weeks, it's not depression. If on and off, it's not depression. So it should be persistent sadness more than 2 weeks, okay?
Okay.
Yes.
Even if the patient is looking at your eyes, even if the patient is looking at your eyes, okay? So the patient has depression in case he has persistent sadness. Poor eye contact can support the diagnosis, but good eye contact will not rule out depression. Okay. Okay.
Okay.
This one, postnatal depression, until proven otherwise. If you find the female patient in the exam, so you have to diagnose maybe postnatal depression or postnatal psychosis. How to differentiate? If the patient is female and looking down, postnatal depression. If the patient female and looking at your eyes and irritable, so postnatal psychosis. Clear this point?
Yes, sir.
Please.
Okay. If the patient is standing or walking or happy, think about mania. So, mania or likely mania?
Likely.
Likely mania.
Okay. If more than 2 weeks persistent happiness, is it mania or likely mania?
Mania.
Likely mania. Likely.
Likely mania.
Why? Because sometimes I am happy for 1 month. It doesn't mean I have money. Okay. If you ask me why you are happy, I will say because I am okay, my family is good. That's why I'm happy. So it's not money. But if you ask me why you are happy, if I tell you I am the king of the world, this is money or not?
Yes, sir.
Money. Okay. So happiness for unreasonable cause. So this is mania. But if the patient or the person is happy for reasonable cause, it's not mania, right?
Okay, so
Yes.
Yes.
Okay. If you ask the girl why you are happy, if she say I'm the most beautiful in the world, so this is mania. Okay. So if the patient is happy with high mood more than 2 weeks persistently, so it's mania, but you should ask about the reason. Okay. If less than 1 week, it's hypomania. Okay. Less than 1 week, it's hypomania. If the patient has on and off, sometimes sadness, sometimes happiness, what is the diagnosis?
Bipolar.
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 Bipolar disorder. Okay. Anyway, it's not topic in the exam, don't worry. So if the patient is sitting, irritable, looking at your eyes, good eye contact, what is the diagnosis?
Psychosis.
Psychosis or schizophrenia. If the patient has psychosis and she has bears 1 month ago or 1 week ago,
Postnatal psychosis.
if the patient has psychosis and she's using illicit drugs, what is the diagnosis?
Substance abuse related.
drug-induced
Drug-induced
psychosis.
Drug-induced psychosis.
Drug-induced psychosis. Okay. If the patient is using alcohol,
Alcohol-induced.
Alcohol induced.
okay. So you have 3 tasks. I'm considering as 2 tasks. If they say assess mental state exam, you will talk to examiner or actor.
Examiner.
Examiner.
Yes. If they so you will present your finding in the end. If they said assess mental capacity or assess self,
Explain to the patient.
the same. So talk to the patient. Okay. Okay. Most likely, most likely they will ask you to assess mental capacity or assess self-harm in depression or self-harm only. Clear?
Okay.
Assess mental state exam, it could be in depression, could be in mania, in psychosis, like that. Okay. So we have for practice Nazar, Muhammad, Mona, Tamil, Safwan, Fatima, Marwan, Basamat, Sima, Somya, Asma, Araf, Tasneem. Okay, if anyone interested to practice, you can raise your hand. If you don't know how to raise your hand, you have option to raise your hand. And Osha also. Okay. Okay. So, Nazar,
Yes, Dr. Hani.
how are you?
I'm good, thank you. Yourself?
Okay. So, this patient misbehaving. Misbehaving here, it could be any psychiatric problem. So, the patient may be depression, maybe psychosis, maybe mania, maybe impaired cognition, right?
Yes.
The age is old age,
No.
so unlikely to be
Cognition disorder.
impaired cognition because the patient is not old. Uh, is it likely to be psychosis? Did they mention here the patient hearing of voices or see anything? Not,
No.
no, so
No.
unlikely to be psychosis. Okay, so it could be depression or mania, right?
Yes.
How to know that? You can confirm that. Of course, in the exams, they will give you any clue in the scenario, but I'm talking about what if they did not give you any clue. So check the patient. Once you go inside the room, you will understand the diagnosis and you will start the questions of the point relevant to the diagnosis. Clear?
Okay.
Yes. So you have 30 seconds and 6 minutes. And please, guys, you can give feedback and you can give marks to Nazar. You have 30 seconds and 6 minutes.
Okay.
Okay, you can start.
Good morning. I'm Dr. Nazar, A&E Registrar. May I confirm your name and your age, please?
I'm Hadi.
Nice to meet you, Mr. Hadi. Uh, uh, how can I help you today, Mr. Hadi?
I feel bad.
Well, I'm so sorry for that. Are you comfortable now? Are you okay? I'm so sorry for that. Mr. Hadi, I'm here today to collect some information about your mental health. We'll be in private room. All the information will be confidential, and you can stop me at any time. Is that okay for you?
Okay.
Okay. Since when did you start to feel bad, Mr. Hadi?
1 month ago.
I'm so sorry for that. Is it affecting your activity of daily living at all? Is it continuous or on and off, Mr. Hadi?
Always feeling bad.
Okay, I'm so sorry for that. And why do you feel that?
I'm terminated from work and I'm single. I'm divorced.
I'm so sorry for that. Mr. Hadi, do you have any problem with the sleep?
Yes.
Do you have any problem with your sex drive if you are sexually active? Any problem in your appetite at all?
No.
Do you feel weak?
Yes.
Are you enjoying the things like before?
No.
Okay. Do you have a period of feeling high or in good mood or energetic at all?
No.
Okay. Do you think there's something or someone interrupt your thought at all? Do you see, hear, or taste anything that the other cannot?
No.
Okay. Mr. Hadi, do you know what the time now? Is it morning, evening, night?
Evening.
If you remember, evening. If you remember, who am I?
Nazar.
And where are we?
Hospital.
Okay. Did you try to harm yourself in the past?
No.
If you will go home, will you try to harm yourself?
No.
Okay. All right. Do you have any other medical condition?
No.
Any previous surgery?
No.
Are you in any prescribed medication?
No.
Is there any disease running in your family?
No.
Have you had any psychiatric disease or illness before?
No.
Okay. Where do you live and with whom?
My family in downtown.
Okay. And you said you lost your job. Is that correct?
Yes.
Okay. Do you smoke or do you drink alcohol?
No.
By any chance, do you use any illicit drugs at all?
No.
Okay. Are you allergic to any medication known to you?
No.
All right. Would you like to add anything else, Mr. Hadi?
No.
Okay. Mr. Hadi, if you smell a smoke at home, what will you do?
I will call for help.
You will call
For help.
help. Okay. Do you think that you have a medical problem and you need a medical attention?
Yes, I know.
Okay. And what's your concern, Mr. Hadi?
I want a treatment.
I appreciated your concern, Mr. Hadi. I need to present this finding to the examiner. So I have Mr. Hadi, who is 33 years old, who presented with the symptoms of depression. Mr. Hadi is well dressed. He's sitting calm. There's no any eye contact. His speech is low tone and low pressure. There's no any thought disorder. There's no any insight impairment. There's no cognition impairment. There is no any judgment impairment. There's no any hallucination or delusion disorder. Mr. Hadi need a psychiatric assessment under mental health team. In the meantime, I need to rule out any organic cause by doing general examination, urine test, blood test, including biochemistry, hematology, toxicology as well. Yes, thank you.
Okay, your time done. Okay, excellent, Nazar. What do you think, guys? How many marks for Nazar?
10.
10 marks.
10 marks.
Okay, this patient, he has low risk factors or high risk factors?
Low
High
risk.
risk
Low
factors.
risk factors.
Low
Low
risk.
risk.
The patient is not using illicit drugs or smoking. The patient also he did not harm himself or he is not planning to harm himself. The patient he has insight, he knows a problem. He has judgment. The patient want treatment. He came for treatment, right? Okay.
Right.
Even if the patient refuse, you will assess his capacity, and if he has capacity and he wants to discharge, so no problem, you can discharge because it's safe to be discharged. Here they said assess mental state exam, so that's why Nazar presented his finding to the examiner in the last minutes. Okay, so I think the approach is clear now, right?
Yes.
Okay,
Yes, sir.
well done. In the exam, it will be very obvious. Is it low risk or high risk? It will be very obvious. This patient needs admission or just a psychiatric assessment. Okay. So I will give you 10 out of 10. Perfect.
Thank
Muhammad,
you, boss.
welcome.
Hello,
Muhammad,
Dr. Hani.
how are you?
Good, thank you, thank you.
Okay. So accuracy, I think he covered almost 100%. Skillfulness, he was very fluent. His he was giving the questions in bases, information in bases. Even the attitude, his pressure of speech was same as the patient. Also, the speed same as the patient. He checked comfortability, pain. He explored all questions very well. Patient's structure, he was very organized. Safety, so I think he gave good and correct decisions regarding management plan. So he deserves 10 marks.
Dr. Hani,
Yes,
I'm asking that any person, I should tell him that you need to assess him by mental assessment team, mental health team.
if the patient has depression or mania or psychosis or self-harm or impaired cognition, he should be assessed by mental health team. Okay, next one, Muhammad.
Hello, hi, Dr. Hani.
Okay, here misbehaving, is it likely to be impaired cognition with this age?
No, unlikely. This young
Is,
one.
is it psychosis? Did they mention anything regarding hallucination in the scenario?
No,
No. So it could be depression, it could be mania. Did they mention self-harm here in the scenario?
no,
No. Okay. So unlikely to be self-harm, but you should ask him also.
yes,
Maybe not mentioned here, but once you ask him, he will say yes. Okay. From the position, it seems like depression, right? Okay.
right.
They said assess mental capacity. So you will talk to the examiner or to the actor in the end?
To the examiner.
To the actor.
Actor.
Oh, sorry, assessmental capacity, yes.
Please mute your mic, guys. If I find any mic unmuted, sorry, I will remove the user, okay? So here regarding assess mental capacity, please guys, if you want to pass with very high score, you should be good listener. If I say assess mental mental capacity, means talk to the actor, to the patient. If they said assess self-harm, it means assess mental capacity. It means talk to the actor in the end. If they said assess mental examination, mental state exam, so it will be talk to the examiner. Okay. Here, mental capacity. How many points, Muhammad?
Four.
Your
4 points.
Hello?
yes. Assess mental capacity. How many points?
Yeah, yes, 4 points, Dr. Hani.
4 points. Okay. 4 points. It means understand the information, retain the information, weigh the information. So what is the information? It means the management plan, right?
Yes, right.
Management plan here, it means clinical reasoning decision making. So after you finish the data, you will assess mental capacity in the end. Why in the end? Because you said information. Information, it means management plan. You cannot give management plan if you don't have idea, is it low risk or high risk, right?
Yes.
Okay, so you will wait after the third open question, after judgment, after insight, after everything, then you will give him the information, the management plan, the clinical reasoning, decision making. Then if he accept, the session finished. If he said okay, thank you, you will thank the patient. If he said no, don't convince him. If he said no, don't convince him. Just ask him the 4 points. Did you understand the management plan? Yes. Can you repeat that to me? Blah, 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 blah. Do you know the risk and the benefit? The risk is blah, blah, blah. The benefit is blah, 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 blah. Is that okay with you? He will say yes. So what is your final decision? Blah, 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 blah. Then if he accept, finished. If he did not accept, so you can convince him here. Okay? You have 30 seconds and 6 minutes. You can start.
Hello, hi, my name is Dr. Muhammad. I'm one of the ED doctors. May I confirm your name and your age, please?
Yes, I'm Hadi. I'm 33.
Nice to meet you, Mr. Hadi. Mr. Hadi, I have been asked to get some data from you. The conversation is going to be in a private room, and one nurse is going to be attending with us for support. Is that okay with you?
Okay.
Okay, Mr. Hadi, how can I help you today?
I feel bad.
Are you? Oh, I'm sorry for that, Mr. Hadi. Are you comfortable, Mr. Hadi? Would you like me to give you any painkillers or anything?
No.
Okay. Sorry, Mr. Hadi. Since when you're feeling bad?
1 month.
Is it an on and off thing?
Always feeling bad.
Okay. Okay. What do you think the reason behind this, Mr. Hadi?
I'm terminated and I'm divorced also.
I'm sorry for that, Mr. Hadi. Mr. Hadi, has this affect your sleeping?
Yes.
Okay. Has this affect your appetite?
Yes.
Okay. Do you feel like you're not enjoying things like you used to be before?
Yes.
Okay. Are you have you lost your sexual drive if you are sexually active now? Okay. Uh, Mr. Hadi, do you feel like your thoughts has been interrupted or anyone interrupting your thoughts?
No.
Okay. Mr. Hadi, sorry for this question. Do you know where we are right now? Okay. Mr. Hadi, do you still remember my name? Okay. Mr. Hadi, can you tell me what's the date today?
I know.
Sorry, Mr. Hadi, can you tell me what's the date today?
Saturday.
Okay. And Mr. Hadi, have you tried to harm yourself by any means?
No.
Okay. If we are going to send you home today, are you going to try to harm yourself or harm the others?
No.
Okay. Mr. Hadi, if you smell any smoke at home, what will you do?
I will call for help.
Okay. Mr. Hadi, do you feel like you are having problems and you need help? Mr. Hadi, do you feel like you need problem or you need help?
Yes,
Okay.
I know.
Okay. Mr. Hadi, do you have any past medical problem? Hello?
Yes.
Mr. Hadi, do you have any medical problem?
No. I know, doctor.
Hello?
Yes, I can hear you, doctor. Can you hear me, guys?
Yes, I can hear you now.
Yes, sir.
Okay, the problem from your side, doctor. You can continue.
Sorry, Mr. Hadi, do you have any past medical problem?
No.
Okay. Do you have any surgical problem in the past?
No.
Okay. Do you have any psychiatric problems?
No.
Okay. Do you take any prescribed medication?
No.
Right. Mr. Hadi, do you smoke cigarettes or do you drink any alcohol?
No.
Okay. By any chance, do you take any illicit drugs?
No.
Okay. Mr. Hadi, who do you live with and with whom?
I'm living alone.
Okay. Mr. Hadi, what's your concern? Would you like to add anything?
No.
Okay, Mr. Hadi, based on the information I have collected from you, I think you are having a sign and symptom suggesting of depression. It could be very likely because you've recently lost your job and you lost your family as well. I would like to keep you in the hospital, and I would like the mental health team to come and do your assessment. In the meantime, I will need to do an investigation, including toxicology screen and full blood counts, just to rule out any organic causes. We may or may not need
Thank you.
do a scan.
Your time done. Okay, what do you think, guys? How many marks?
6 marks.
9, 8 or 9.
Okay, I think he covered almost all the points. Okay, this patient, he has low risk or high risk?
Low risk.
Low risk patient.
Low risk, sir.
Hello?
Yes, low risk. Okay, so this patient needs a psychiatric assessment or admission?
Psychiatric assessment.
Yes.
Submit.
So I will give you 1 minute to give a good management plan.
Okay, Mr. Hadi, I would like the mental health team to come and do your assessment. In the meantime, I need to do investigation, including full blood count, urine and electrolytes, infection markers, toxicology screening. We may or may not need to do a scan for your head based on the blood results. And are you happy with this plan?
I want to go home, doctor.
Okay, Mr. Hadi, can you tell me why do you want to go home? Because
No, I said don't convince the patient in the beginning. Please, if you want to pass with very high score, good listening to me. I said
okay,
check the 4 points first.
okay. Mr. Hadi, do you understand? Do
Yes,
you
I
understand what I have just said?
Yes.
Okay. Do you know what's the risk and what's the benefit?
You should tell me.
Okay. Could you repeat to me what I have just said? So just I make sure that you understand what I have
Wait,
just.
please, Muhammad, wait, please. It should be like that. According to your data, it seems like you have symptoms of depression, and this could be low risk factors. Okay. But for this problem, you need psychiatric assessment under mental health team. What do you think? Like that, give him the information, the management plan. Easy?
Yeah. Okay.
So after that, maybe he will say yes. Okay. So finished. I said I want to go home. Okay. So you can tell him, did you understand the management plan? I said, yes, I understand. Can you repeat that to me? Yes, you said I have symptoms of depression and I need psychiatric assessment under mental health team. Do you know the risk and the benefit? You should tell me. Okay. Do you know
Okay.
the risk and the benefit? If you stay in the hospital, you will receive treatment. You will be assessed by mental health team, and they will check if they will give you any treatment for that. If you go home, the problem will worsen. The problem will worsen, and you might harm yourself or others. Is that clear? Is it, Muhammad?
Yes. Yes.
Then, if I said yes, it's clear, then you will ask, what is your final decision now? Okay. So
Okay.
if I say yes, okay, so they're finished. If I said no, I want to go home. So here you can convince me after assessment of mental capacity. Why? Because the task here is assessment mental capacity. They did not ask you to convince the patient, right? They did not ask you admit the patient. They did not ask you let the patient to stay in the hospital. Clear now?
Yes, very clear. Yeah.
Okay. Why? Because if the time finished, okay, then you have already finished your task. You will get high marks. Easy?
Yes.
But if you try to convince him and you did not assess his capacity, and if the time finished, here you will not get the high score. You will get maximum like 7 marks. Did you get my point?
Yes.
Okay.
Yes, very clear, Doctor.
Okay. Okay. Well done. Next one. So I will give you 8 marks, Muhammad. Next one, Mona.
Dr. Hani, I have a question. Can you repeat like mental capacity, the third and fourth one, like how we have to tell the patient about balancing their options, and the last one, inform communicate others of the decision? Sorry, I didn't understand fully.
Sorry, again, the question?
Sir, in mental capacity, how do we, the third point and the fourth point, how do we tell the patient about the balance, weighing up their options, and the fourth point, inform them,
Here,
communicate.
this is clinical reasoning. Clinical reasoning. Okay.
Mm.
So clinical reasoning here, it means management plan. It means you will give the patient information. Okay.
Okay.
And assess mental capacity, it means you will give them the management plan, you will give them the information. Okay.
Mm. Yes.
Then you will ask him if he accept or not.
Okay. Yeah.
If he accepts, the station finished. No need to assess his capacity.
Okay.
If he refused, you will ask him the first question. Did you understand the management plan? It means, did you understand the information? Okay.
Yes. Okay.
Then the second question, you will ask him, can you repeat that to me? The third
Yes.
one, do you understand the risk and the benefit? So if you
Okay.
give him the risk and the benefit, if you started by risk, it's okay. If you started by benefit, it's okay. Anyone. Okay.
Okay, sir.
So here you will tell him, do you understand the risk and the benefit? If you stay here, you will receive blah, 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 blah. If you will go home, the problem will worsen, blah, blah, blah. Clear?
Yes, sir.
Then the fourth point, what is your final decision? Easy?
Yes, sir.
Okay.
So,
Okay, guys.
if we have to assess the mental capacity and he accepts the decision, so we don't have to move forward with the mental capacity. Right, sir?
Okay. So next one, Mona.
Yes.
Next one.
Sir, excuse me.
We have
I
no
have a
time,
question.
guys. We have no time. Ask it quickly, please.
Okay, so after we assess the capacity, if at some point we decide patient lacks mental capacity, do we say it out loud to the examiner or?
No, assess mental capacity, you will talk to the actor only.
Right.
Okay. Assess
Okay.
self-harm, you will talk to the actor only. Clear?
Okay. Okay. So patient is unable to retain or she is unable to repeat or whatever, then it's just attributed that patient lacks capacity. That's all, right?
If the patient lacks the capacity, unlikely to be
Yes.
like in the exam.
All right. Okay. Okay. Thank you.
Because if he lacks the capacity, you cannot assess his capacity.
Yes, true.
Okay. Mona, I will give you break 5 minutes to prepare this station, okay?
Okay.
Okay, Mona?
Yeah, I am ready.
Okay, you can start.
Good evening. I am Dr. Amuna, emergency registrar. May I confirm your name and age, please?
Yes, I'm Hadi. I'm 33 years.
Nice to meet you, Mr. Hadi. How can I help you today? I need to take some data from you regarding your your mental health. We will be in private room. One nurse will be with us as a chaperone. Everything will tell me will be confidential, and you can stop me at any time. Can you please tell me more about your condition?
I feel bad.
Okay. When did you start feeling sad?
1 month ago.
Is it continuous or on and off?
Always feeling bad.
Sorry for that. Is it affecting your activity of your daily living?
Yes.
Do you think why you feel bad?
I'm terminated and I'm divorced.
I'm sorry for that. You are terminating and you are feeling sad. You are trying to harm yourself.
Sorry?
You are trying to harm yourself.
Yes.
What do you do?
I tried to kill myself last week.
How you try to kill yourself?
I tried to
You
hang myself in last week.
Okay. When did you do this? You cut your wrist?
I tried to hang myself.
Hang yourself. Okay. You hang yourself because you lost your job and you are divorced. Am I right?
Yes.
Did you take any precaution before you doing that? Okay. Did you under effect of alcohol or any illicit drugs while you doing that?
No.
Did you feel angry or guilty after that?
No.
What was the time between your thinking and your attempt? Okay, Mr. Hadi. Any change in your mood? What is the year now? Where are you now, Mr. Hadi?
Hospital.
Okay. Do you remember who am I?
Mona.
Okay. Do you feel someone interrupting your thought, taking thought from your mind or putting thought in your mind?
No.
Do you hear or see voices other cannot?
No.
Do you smell or taste anything other cannot?
No.
Okay. Do you have any past medical disease or mental disease?
No.
Any prescribed medication?
No.
Any allergy?
No.
You have any disease that run in your family? With whom do you live and where do you live?
I'm living alone.
Okay. Do you smoke?
Yes.
Drink alcohol?
Yes.
Okay. You say that you are terminating from job. You and also you are divorced. You have any current or past issue with police?
No.
What would you do? What would you do if you could smell a smoke in your home?
I will kill myself.
Do you think you have a problem and you need medical help?
I know.
Would you like to add anything? What is your concern, Mr. Hadi? Okay, I appreciate your concern. According to your data, you have a high risk to harm yourself. And you need assessment, you need psychiatric assessment and the mental health team. And you will get proper treatment. Is that okay with you? Is it clear for you? Did you understand that?
I want to go home, doctor.
Can you please repeat that for me?
Yes, you said you want. I want to be assessed under mental health team.
Okay, so what is your decision now?
You should tell me the risk and the benefit.
Okay, if you go home, if you stay here, you will get you will get a psychiatric assessment and your condition will be improved. And if you go home, you could harm yourself or maybe others, and your condition will be worsening. Is it clear for you?
Yes.
So what's your decision?
I want to go home.
If you go home, would you try to harm yourself?
Yes.
I can see that you want to go home and you kill yourself, and for your best of interest and public interest, and I need to admit you. And if you accept, it will be voluntary admission. What do you think?
No, I want to go home.
For the best of for your best of interest and the public interest, I need to admit you, and and this admission will be compulsory. Is that okay for you?
No, I want to go home.
You have a high risk to harm
Thank you.
yourself
Thank
or
you.
maybe others.
Thank you.
Thank you. Thank you.
Okay. So this patient has low risk or high risk?
High risk.
High risk.
High risk. It's
Yes.
obvious, right?
Yeah.
Okay. So the patient is using illicit drugs, is drinking alcohol, living alone. Regarding this station, what is the most important task?
Self-harm.
Self-harm.
Assessing.
You should start by self-harm, right?
Yeah.
So after introduction, after everything, you will go for self-harm. You can say, I have been informed that you try to harm yourself. So you have three
Yeah.
questions. I mean, self-harm here, it's divided into three parts: past, present, and future. Okay?
Okay.
So I have been informed that you try to harm yourself. Is that right? Yes. How did you try to harm yourself? By blah, 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 blah. This is the current. For example, today or
Yeah.
1 hour ago or like that. So you should explore more regarding this point, current, now, okay? Then
Okay.
you will go for past. No need to go deep in questions. Just to show the examiner that you covered this point, that you covered this area. Clear?
Yeah.
No need for did you activate social media? What is uh, how long did it take before thinking about doing? It's not a big issue. No need for details. Okay. So the most
Okay.
important, I have been informed that you try to harm yourself. How? Just to give information. And then, did you try to harm yourself in the past or before? Okay. Then the future. If you will go home, will you try to harm yourself? Clear now?
Yeah. Clear.
You should explore self-harm first because the topic is self-harm, not depression. Okay? Okay.
Okay.
Okay, so regarding this station, I think you covered almost everything, but you are not optimizing your approach. You ask about self-harm again in the after the management, right?
Yes.
Okay. Okay, so I think you did well. So this one, I want you to think about self-harm management. So according to your data, you have symptoms of depression or not?
Yeah.
How you know? I feel bad.
Because yeah.
I more than 2 weeks and persistent. Excellent. So according to your data, you have symptoms of depression with self-harm, whatever in the past, now, and you are planning to do so. Okay. So show the examiner that you covered the point of depression, that you covered the point of self-harm, then you will give the management plan to the patient. So according to your data, it seems like you have symptoms of depression and you tried to harm yourself in the past and today, and you are planning to do so in future. So I'm sorry, you need admission for assessment and the treatment. Clear now? Admission for both.
Yes.
Admission for assessment and treatment. Okay. Then you will ask him, did you understand? Or is that okay with you? If he said, okay, done. If he said no, did you understand the management plan? Okay. Then go for, you will go for the next point. Do you understand the risk and the benefits? And tell me if you stay in the hospital or if you be admitted in the hospital, you will receive treatment or assessment and the treatment. Okay. If you will go home, you will harm yourself or others. Okay. You might kill yourself or others. So what is your final decision? Blah, 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 blah. If you insist to go home, then you have to go for the second point. Okay. So I advised you to be admitted under your wish, but I'm sorry, in case you are insisting to go home, so I need to admit you, and this time will be against your wish. Is that okay with you? Clear? Okay, so I will give you 8 out of 10 marks. Well done. Tamim?
Yes, sir.
Okay. So this one will be the same, so we will skip because postnatal depression will be the same, but female. Okay. This one, what is the diagnosis?
Mania.
Mania. Mania or
Until
psychosis.
mania. Why psychosis? Okay. Did they mention here hearing voices?
No.
Delusional, sir.
Sorry?
Delusional.
Did you listen to the previous recordings?
Yes, sir.
Okay, so did I mention about this one psychosis?
No,
No,
sir.
but I was thinking about it. I had that doubt even then.
If you want to pass, don't assume anything. If I give you information, keep this information. They will not change the exam. Okay?
Yes, sir. Thank you, sir.
Okay. Just follow what we will say by letter, by word. Okay? So the most beautiful in the world or the king of the world. So this is many until proven otherwise. If they said hearing voices or see anything which others cannot, it means hallucination or things like that. Okay. So here the patient will be walking, the patient will be smiling or laughing, okay? And the patient has good eye contact, okay? So you have 30 seconds. Here they said assess mental state exam. So you will talk to the examiner or to the actor?
Examiner.
Exam. You have 30 seconds
Examiner.
and 60 minutes.
Can I start, sir?
You have 30 seconds. You can start.
Good morning. I'm Dr. Tamil. I'm the ED registrar. May I know your name and age, please?
I'm Sheena. I'm 31.
Nice to meet you, China. I have been asked to take some data from you. We are in private room. There will be one nurse with us. Anything you tell me will be confidential. So I will be asking you some questions regarding your mental health. Is it okay with you?
Yeah. How are you, doctor?
Okay. Are you comfortable, China? Do you have any pain?
Yeah, I'm okay. I'm okay. How are you?
Okay. How can I help you today, Miss China?
I'm okay. I'm fine. I'm so happy.
Okay. What brought you to the hospital today?
They brought me here, my family.
I see. So how are you feeling right now?
Yeah, I'm so happy.
Okay. How long you have been feeling like this, China?
Yeah, I'm always feeling happy.
I see. Okay, China, do you have any difficulty to sleep?
No, I'm okay.
Okay. Are you enjoying things like that you usually do?
No,
I see. Any change in sex drive?
no,
Okay. Any change in appetite?
no,
Do you feel weak?
no,
Do you have periods of feeling high, energetic, or good mood?
no.
Okay. So, China, do you know who I am?
Yeah, you are Tamil.
Okay. I see. Okay. So, do you know where are we right now?
Hospital.
Hospital. Do you know what day is it today?
You know, I bought makeup yesterday, and I think this is the best.
Okay.
Yeah.
Miss China, do you feel like someone interrupting your thoughts or taking thoughts from your mind?
Actually, I bought them from France, and maybe this is expensive one.
Or do you feel like anyone putting thoughts into your mind?
I bought before in the past year, and but not
Do
like
you, okay, Miss China, do you hear any voice that no one can hear?
no,
Uh, do you ever try to harm yourself previously?
no,
If you go home, will you think of harming yourself, Miss China?
no,
Okay, Miss China, do you have any previous medical problems?
no,
Previous mental health illness?
no,
Any prescribed medications?
no,
Any allergy?
no,
Any disease that runs in the family?
no.
Are you in stable relationship, Miss China?
No.
Okay, what do you do for living, Miss China?
Yeah, I'm studying.
Okay. Okay. Where do you live and with whom do you live? Do you smoke, Miss China?
No,
Or drink alcohol?
no,
Or by any chance, do you use illicit drug?
no.
Okay. Miss China, so what will you do if you see a fire or smoke in your house?
Actually, I bought 3 dresses because we are preparing for party.
So, Miss China, do you feel you have a medical problem and that need medical help?
I'm trying to do ceremony. You can attend with us.
Okay, so I would like to present my findings. Miss China appears well dressed. I think quite flamboyant also. She's like pacing around but have a good eye contact. Her speech has a high tone and volume and a bit of a pressure of speech with a flight of ideas. She has an elated mood, but there is no thought disorder. However, she does has a grandiose delusion. Cognition is intact, but however, she does have poor judgment and poor insight. And Miss China is 31 years old, presented with symptoms of manic symptoms. So I would like to keep her in the observation room, do a complete examination and do a blood test, including a full blood count, thyroid function test, and then a toxicology screen and biochemistry blood gas to rule out organic cause. And I will refer her to her mental health team to be assessed by them and probably might need to start a mood stabilizing medications. Thank you.
Okay, thank you. Your time almost finished. Okay, excellent. Excellent, Tamim. So what do you think, guys? How many marks for Tamim?
10, sir.
Okay,
10.
so regarding accuracy, you almost mentioned all the questions. Okay, and regarding skillfulness, she is very fluent. Also, try to make your voice the same as the voice of the patient. So if depression, try to make your voice low pressure of speech and low tone. In mania, make your voice audible, but not very loud. Audible, just audible.
Okay, sir.
Yes, I think you did very well in this station. Regarding the patient has flight of ideas, you should mention that so you can say the patient has flight of ideas. Um, if the patient has high mood, you should ask. You did not ask me in the beginning. So I said I'm
Yeah.
feeling happy. You did not ask me why do you feel so happy, okay?
Yeah, okay, sir.
Because if the patient feeling so happy for no reason, it's a mania. But if she's so happy because of something reasonable, it's not mania, right?
Yes, sir.
Okay. Maybe she is in love. Maybe her father was sick and now he is good. That's why she is happy. Okay. So you should ask. So I will
Okay,
give
sir.
9 out of 10.
Okay, thank you, sir.
Well done. Safwan,
Assalamu alaikum, sir.
alaikum salam. So here assess mental state exam. You will talk to the examiner or the actor? Examiner. And here the patient is 31. Okay. So this manual, to not waste the time, we can jump to the next station. Better. Okay. Hearing voices. What is the diagnosis?
Psychosis.
Psychosis.